So another ultrasound-guided technique for using high-intensity focused ultrasound is a technique that was developed by a group at Columbia University, which uses harmonic motion imaging. Now, harmonic motion imaging, or HMI, it uses the acoustic radiation force of the ultrasound transducer to interrogate the biomechanical tissue properties of the tissue. And this is quite interesting because tumors, whether they're benign or malignant, generally are more stiff than the surrounding healthy tissue. So this would not only help you identify where the tumor is, but also could help you assess the treatment. So you can see this in some of their images here. So this is an invasive ductal carcinoma that you can see on a B-mode image. And then you can see the equivalent images with the harmonic motion imaging, both with and without. Here on the bottom you can see the displacement map is overlaid there. Now you can see within the white regions, which is where the tumor is, it is less displacement, which indicates that that tumor is stiffer than the surrounding tissues. In addition, as you thermally ablate things, that could become even stiffer. So this is quite interesting because they're able to show that they're able to see a displacement difference between both malignant and benign tumors. And because of this, they can even distinguish between the two different tumor types, both malignant and benign. So this shows the potential of using harmonic motion imaging to evaluate a tumor and a HIFU treatment if you're looking at this for breast cancer. So now we'll move on to MRI-guided HIFU systems. So this is the MOOC system. It's installed here on a Siemens MRI magnet. And you can see that the table here that's used for the HIFU treatment is actually installed on the existing MRI table. Now within this table you have a treatment cylinder where the breast is suspended that holds not only some imaging coils for the MRI, but also the transducer that's used to treat the tumor. So you can see the transducer face there off on the right with the yellow lines indicating where the ultrasound beam is focusing for this particular treatment. And so in this case, the acoustic coupling between the transducer and the breast is achieved with degassed water, and that's quite common both in ultrasound and MRI-guided HIFU studies. Now, MRI is the most sensitive technique that you can use to image breast cancer. Now, while it is sensitive, sometimes it is not specific enough. However, in this case, you can see for this woman who is going to be treated later with high-intensity focused ultrasound, you can see her 2.1 centimeter tumor as indicated by the green arrows really well. Now, in this particular image, which is a contrast-enhanced image, it really lights up both the fibroglandular tissue and the tumor. So you're really able to visualize the full extent of the tumor, which is really helpful with this diagnostic MRI. One of the main benefits of MRI-guided HIFU is you're able to get quantitative thermal images. So this MR thermometry, which has been showing acquired over time, is overlaid on a T1 weighted contrast MRI. Now this is quite helpful for the treating physician as you're able to track the individual sonications, get this quantitative metric that can then be used to assess your treatment and whether or not it was effective. This is nice because it can be tracked over time, so you can get these nice quantitative curves. This is just for a single voxel in the prior treatment. So you're able to see the rate of the temperature rise as well as the tissue cooling, and you're able to use this curve in many ways to assess how the treatment is going and whether or not efficacy will be achieved. So similar to the harmonic motion imaging, MRI-guided HIFU can also use the acoustic radiation force of the beam to provide a complementary metric that can be used to interrogate the biomechanical properties of the tissue. So in this example, it's quite helpful because this breast here that's being treated is homogeneously fatty. And you can see here with this white arrow, quite a small tumor. Now this tumor is so small that even though you could measure temperature in it, it's probably not going to give you the SNR that you need. So in this case, the acoustic radiation force was used to evaluate where the ultrasound beam was targeting. So the way this works is the ultrasound is pulsed, and this pulsing of the ultrasound is synchronized with the MRI sequence to create this displacement map. So the displacement map indicates where the ultrasound beam is focusing, and then you're able to apply the ultrasound as a more continuous wave to achieve the ablation you need. So the differences between the MR temperature imaging and the MR acoustic radiation force imaging is seen here on the right. And you can see on that middle image that's labeled MR temperature, with the white arrow, you can see where the temperature is being accumulated in the tumor. Now, in the fat, in the tissue there in the near field, there's no temperature measurement because that is difficult to do with the proton resonance frequency MR temperature technique. However, when you use the RFI, as seen on the far right, you can see that the displacement map actually goes down into the fat, so you're able to get a more comprehensive view of where the ultrasound is depositing its energy. So it's quite a complementary technique that can be used. So there are many different trials that are present in the literature that describe both ultrasound and MRI guided high intensity focused ultrasound. So in this table, it shows 3 studies that were using ultrasound guided HIFU to treat benign breast tumors or fibroadenomas. So the objective was to reduce the fibroadenoma, and they were able to have a reduction rate anywhere from 43 to 72%. Now, some complications were noted, including swelling of the tumor as well as skin effects such as skin burns or general skin irritation or pigmentation problems. However, it was very well tolerated and treatment times were variable, which is a function of tumor size as well as some other things. So the ultrasound-guided HIFU has also been used to treat breast cancer. Now, all of these studies were performed using the Model JC system, and they were up to almost a 5 centimeter length in the tumor, so quite large tumors. Now, in this case, the ablation rates are variable. Where the ablation rates were 100%, in these studies they actually had quite a wide margin around the tumor, so they were ensured to guarantee efficacy. Now, complications, as you can see, were similar to what was happening with the benign tumors. In this one study, they did have some pectoralis major muscle injuries in all of the patients, and that can occur sometimes in the far field of the ultrasound and does need to be monitored. Now, with MRI-guided HIFU studies, quite a few have occurred, as you can see in this table, and the mean tumor size is perhaps a bit less than what has seen in the ultrasound. Now, the ablation rates are fairly variable, and that really depended on how much of the tumor was targeted and what the primary objective were for these studies. Complications, as you can see, are perhaps a bit less than what happened in the ultrasound imaging. So in general, ablation rate was not up to 100%, a mean rate of about 50%, and the complications were a bit less than the ultrasound guided. So all of those studies that I just showed were using the thermal HIFU to create the ablation of the tumors. Now, it's also interesting to look at how the thermal HIFU can also perhaps impact the immune response that is happening due to the treatment. So in one study by Wu et al., they treated 23 breast cancer patients and they did ablate the whole tumor. But they found in 100% of these patients that the margins were positive for a heat shock protein 70. Now, this is interesting because this heat shock protein peptide complex is very interesting in demonstrating an anti-tumor response. So that is a very interesting result. So in the same population in a similar study, they were showing an increase in general of antigen-presenting cells, as you can see here in these immunohistochemistry stains. So on the far right, you can see a control group that was not treated by HIFU. And when you compare these IHC stains in the group that was treated, you see an increase in macrophages and dendritic cells and B lymphocytes. And this is all very indicative of the immune response that you get with thermal HIFU when you apply it as a monotherapy. In a separate publication by Liu, they showed when they compared the control tumor, the control patients that were not treated by high-intensity focused ultrasound and seen in these gray bars to those that were treated in the white bars. So the gray bars of the control, they did all have a degree of tumor-infiltrating lymphocytes. However, that did vary quite substantially between patients. And although they did have a significant change and an increase in the tumor-infiltrating lymphocytes in all of these different metrics, some patients still did recur after the thermal HIFU occurred. So this, the authors concluded, was a demonstration that thermal HIFU, when used alone, it does not really mount a sustained immune response. And so that is an interesting result that we'll explore a little bit later in this presentation. So what is the current state of thermal HIFU? I've just shown a lot of information. And first, I think it's clear that it's safe. It is a non-invasive, non-ionizing treatment, and that's really important. Because it's safe, you have a low complication rate. It's tolerated very well by the patients, and repeated treatments is possible. And this is interesting because this often cannot occur with chemotherapy or radiation, or it's more difficult for the patient to endure. There are some drawbacks. So one of the main benefits of HIFU is it's completely non-invasive. However, this means that the tumor is not removed, and because of that, you really need to ensure that your efficacy happens, and you need to do that somehow with an imaging biomarker. So you need to ensure your targeting is very accurate, and you need to figure out a way to compensate for patient motion, which has proven to be a bit of an issue in many of the treatment clinical trials that I have shown on previous slides. Currently, and I'll go into this a bit later, there's no really imaging biomarker that's sufficient for assessment right now. Other things that need to be considered is how the pain will be managed. Is the patient going to undergo general anesthesia, which happened in several of the trials that I showed thus far? What kind of sedation is going to be used? All of these need to be taken into account when thinking about where to site these treatments. In general, women's pain has not been studied enough, and this is the same with HIFU. We still need to figure out how best to control this pain and apply the treatment. So as I mentioned, because it is a non-invasive therapy and the ultimate goal is to not resect the tissue, you do not have the advantage, as shown here on these two panels, of taking the resected section out and looking at it with imaging and with histology, shown here in these H&E slides. So this is the gold standard currently of how the breast tumor is evaluated, whether you have positive or negative margins and whether you know if you treated the whole cancer or not. So imaging biomarkers must be developed that can determine this tissue and tumor viability to determine the efficacy of the treatment. Now, we've seen with the ultrasound guided and MR guided, there's several ways to do this. Particularly on MRI, several metrics have been evaluated to assess viability. So you have contrast-enhanced MRI, you have MR temperature imaging, others have looked at diffusion-weighted imaging, as well as T1 and T2 weighted images. Now, you do have multi-parametric imaging contrast that can be applied at the same time that people have looked at, but these have shown variable results. And so there's still work that needs to be done in this area.